You're fatigued, aren't you? Okay, here's the thing. You're tired, you're gaining weight, you're in chronic pain, and you've looked it up online. You've looked at hypothyroidism and you said, this is me. I need to go. It says, go to your doctor, he'll run a blood test. You go to your doctor, you run the blood test, he runs it and he says, nope, your thyroid's fine. And you go, okay, well, it's something else then. Here's the thing. It still could be your thyroid. The blood test might be lying to you. Very possible. Stay tuned. We'll talk about it. I'm Dr. Michael Berglund. Today's subject is, are you hypothyroid? What is hypothyroidism? If you think of it this way, hypodermic needle is a needle that goes underneath the skin. So hypo always means low. Hypoglycemic, low blood sugar. Hypothyroid, low thyroid. If your thyroid, this little butterfly-shaped organ in your neck, is under functioning, you're going to have some of these symptoms. Let's look at the symptoms. Thyroid people tend to have fatigue, depression, brain fog, chronic pain. They're slow to heal. They tend to be cold. Their hair tends to be brittle and dry and tends to fall out easily. Now you might be sitting there going, oh, I didn't have all those symptoms. I just had like one or two. Some of you might be going, I did have all of them. You don't have to have all of them. These are just symptoms or signs of an impaired thyroid. You might have an idea in your head going, wow, I thought I was, but now I'm not because my doctor said I'm not because you ran some blood tests. I'm here to tell you that you still might be. Now, I don't know. I don't know you. I don't know you from anyone. TSH, which is the classic blood test that says, are you hypothyroid or are you hyperthyroid or are you normal thyroid? Hyper is high, hypo is low, and then there's called euthyroid or normal thyroid, and that's where we want you to be. TSH is one of those that's been used in the last probably 30 to 40 years. When I was a med tech, I actually used to run TSH tests in the lab. So we've been doing this for quite a while. The challenge is it's a flawed test because it's indirect. We are measuring an indirect test, and so it isn't going to be entirely accurate. There are some people it's going to pick up. If your TSH is off, then you probably do have hypothyroid. But if your TSH is normal, you still might be hypothyroid. When I used to describe thyroid, it does two different things. One, it's the body's metabolism or furnace. It's the dial that causes the body to regenerate itself, and it's also the body's furnace. If the dial is turned down, the body will be cold. It won't respond well to external cold. You're almost reptilian, where you need to find something warm to warm you up. Normally, the human body is supposed to warm itself up, but a lot of these people, they don't warm up well themselves. The other thing that the thyroid does is it turns over tissue. One of the things it does is it helps the body replace. So if I'm out there and I throw a ball and my right shoulder now is sore, my thyroid is going to be responsible for helping the tissue of my right shoulder regenerate. The problem that people have with thyroid and chronic pain is because basically they have an inbox. You have an inbox, and this is the work that needs to be done, and the outbox is the work that I've done. The problem with the thyroid is when it's low, your inbox keeps getting bigger and bigger. You have this list of stuff that needs to be repaired. That thyroid's not functioning up to par, it's going to get behind on the workload. And you're going to have an accumulation of inflammation. When you have an accumulation of inflammation in the body, we have increased pain. So that's one of the symptoms of a low-functioning thyroid gland. How on earth are we supposed to fix this? The medical system has something called, it used to be Synthroid, now it's just called Levoxyl or levothyroxine. That is basically T4. That's the hormone that your thyroid is supposed to secrete. They've got a synthetic form of that they provide the body. Now the body will also turn around and make T4 into T3. Now T3 is about 20 times more bioactive than T4. If you have a choice of, I need to turn up this dial in my body, okay, because it's turned down, do I want T4 or do I want T3? You want T3. The problem with medication T3 is very unstable. If you make it in a factory, it doesn't have a good shelf life. T4 has synthetic T4 especially has amazing shelf life. So what I do is my plan is actually to provide nutrients or raw materials that the thyroid, if this is a little factory, okay, and basically I have the thyroid cells in there are the workers, all right, And they need raw material so that when they're done, they can kick out T4 and eventually T3. Ultimately, my goal is to help the thyroid start making its own hormone so that I don't need to be putting all these raw materials in the body. The challenge with the old way of doing things is that if I give medication, that's not helping your thyroid, that's helping your body replace your thyroid. I don't want to replace your thyroid, I want your thyroid to function better. So the bottom line here is, you need to figure out, is it in the realm of possibility that your thyroid's underfunctioning? And if it is, we need to figure out what nutrients we can provide your thyroid to help it function better. Once we figure that out and we see benefit, then we know you were hypothyroid and now you're not. I wish you luck treating your thyroid. It's a challenge, it's hard, but it's worth it. This is Dr. Michael Berglund, and I'm here at Common Sense Medicine.
Cold intolerance. Low body temperature.
Low body temperature.
Almost never sweats. Depression.
Depression.
Infertility.